Well, welcome back, everybody. Good afternoon to you all again. It's a pleasure to chair this afternoon's sessions. I hope you had an enjoyable and informative and constructive engagement with the breakout sessions that we've just had. It's now my pleasure to welcome Vicky Ford MP, the Children and Families Minister, to address us this afternoon. Vicky is an MP for Chelmsford, but also, and importantly for us, Parliamentary Under Secretary of State in the Department for Education for Children and Families, a role she was appointed to in February this year. So she covers all the issues of children and families and early intervention, which we're debating and discussing today. And we're delighted that she's been able to come to speak to us this afternoon. Minister.
Thank you so much, Nick. Good afternoon, everyone. Thank you for inviting me here today to talk about early intervention and the really positive difference it can make to the lives of children and their families. The fact that you're all joining us remotely is, of course, a sign of the times, and the pandemic has created not only a global health crisis, but also unparalleled challenges for all of us. And it's been a particular challenge for children and families, and an acutely hard period for those who need our support most. I'm enormously proud that at the peak of the pandemic back in the spring, we were one of the very few countries in the world to keep schools and colleges open for vulnerable children. And thanks to the work of the EIF and others, we're developing a good understanding of the risk factors that can impact on a child's development and future well-being. We know that in many situations, intervening early can help reduce those risk factors in a child's life and better support positive outcomes. And today, what I'd like to speak to you about is how we can continue this work together so every child gets the support that they need. I want to start by talking about our manifesto commitment, nearly a year ago this week. The commitment was to champion family hubs. And we believe this hub approach of integrated services can help to ensure families can get joined up support to overcome difficulties and build stronger relationships. And in turn, those stronger families can provide the support that children need and deserve. Now, family hubs, of course, are not a new idea, and nor is there a carbon cutout of what a family hub looks like. They can vary in structure, in shape, and in size. And I've had the good fortune to visit many of them, including the one in my own constituency of Chelmsford. And I know from speaking to my own constituents how valuable that service has been. Last month, the EIF published a DFE-funded report on children's centres and family hubs, and it provides an important insight from the front line and will inform our next steps. But I'm delighted that we will be launching procurement for a national centre for family hubs, and the centre's role will be to champion family hubs and champion those integrated services and work with councils to develop and spread best practice. And we'll also put in place an evaluation innovation fund to build the evidence base on integrated family service models. Family hubs support children of all ages, but we know that the early years presents a huge opportunity for early intervention and to have a real impact. And I'm proud that since 2013, the proportion of children achieving a good level of development at the end of reception year has gone from just 1 in 2 children to now nearly 3 out of 4. But we can do more and must do more. And I want to draw attention to 3 recent milestones which demonstrate the important progress in this area. Firstly, the EIF has been a key partner in the DFE's Early Language Local Innovation and Excellence Programme, that's ELI. Last week, we published an independent evaluation which found evidence of improved partnership working, senior leadership engagement and strategy development. In partnership with Public Health England, we've trained 1,000 health visitors in supporting early language. And last week, we published a new early language identification measure and intervention tool. And this will help health visitors to identify and support those children who most need it. And finally, I'm delighted that more than 30%, 1 in 3 primary schools, have signed up for the government-funded Nuffield Early Language Intervention, or NELI. Children receiving NELI support in reception year make on average 3 months of additional progress. And last week, the Chancellor confirmed additional funding to support early language in reception for the next academic year. Another important area is, of course, special educational needs and disabilities. And we all want the same for every child, that they grow up happy, healthy, independent, and achieving in education or employment. And we know those children and young people SEND are likely to need more help to achieve those goals. And we know that you don't just magically become a happy, healthy, productive citizen at the age of 18. That journey starts in the early years and throughout education. And no one agency can meet any child's needs. It's a joint response between families and education and health and care partners. Those goals, good outcomes for children and young people based on collaboration with them and their families, was the driving force between the 2014 Children and Families Act, and it is the driving force behind the current SEND review today. We are putting more money into the high needs block and investing an additional 730 million next year on top of the additional 780 million pounds this year. This means that the high needs block will have grown by over £1.5 billion, or nearly a quarter in just 2 years. But the response to cost pressures cannot just be about the amount of funding available. We're not yet seeing an increase in these children and young people's outcomes, and nor is their experience of getting support improving either. And these are deep-seated problems with no easy answers. But I am clear that making early intervention work for children and young people with SEND is a crucial part of the solution. And whilst the publication of the review has necessarily been delayed by the COVID pandemic, I and the whole of the government remain completely committed to the review, which will be published in the spring. We will be working with a wide range of partners as we conduct the review, and indeed are working with them, crucially including children and young people themselves and their families and carers. An improvement in early diagnosis and early intervention is a common ask of many of those parents of children and young people with SEND. But for example, I've been very heartening to see the groundbreaking work done by the Centre for Applied Educational Research, set up by Bradford in their opportunity area, on the early identification of autism. And DFE and DHSC are now funding a trial across 100 schools testing the use of routinely collected data from the Early Years Foundation score profile, together with teacher observations, to help identify children at risk of having unrecognised neurodevelopmental disorders, such as autism. And the goal is to ensure that these children get the right support in place earlier. It builds on an earlier successful trial in 10 schools, also funded by the opportunity area. And if the latest trial continues to suggest that the Bradford approach is effective, I will look at options to roll it out more widely. Early support is also important for mental health and well-being. And in fact, promoting good mental health and well-being and supporting early intervention is at the heart of the government's priorities at this time. And that's why over the summer we delivered webinars for teachers to promote pupils' mental well-being, and for local areas to support the strengthening of local partnerships so they could further support children and young people's mental health as they return to school. In October, we published the State of the Nation report focusing on children and young people's well-being during the pandemic. And the findings of the report show that many of the elements of well-being have actually remained stable. But we do know that there's more work to be done, because some children are suffering from lower personal well-being than others, and we must continue to invest in that early help for those who need it. And to help with this, DFE has been working with our colleagues at Health and the NHS to launch the Wellbeing for Education Return Training. And this £8 million initiative is helping schools and colleges to support their pupils and their students, their parents, their carers, and their own colleagues. Early help is, of course, not only about early years. We want all children to benefit from world-class education. And that's why we've provided a £1 billion package of catch-up support this academic year, which consists of a universal catch-up premium worth £650 million, but also the £350 million national tutoring programme, which provides additional targeted support for disadvantaged pupils and students, as they may have been the hardest hit by the disruption to their education as a result of the pandemic. Another particularly vulnerable group that I've been focusing on are children and young people in alternative provision. And this group are particularly then additionally vulnerable when transitioning between AP and further education. We put an extra £7 million for AP schools to support last year's Year 11s to make that successful transition into their post-16 settings, because we knew that as a result of COVID, this group were facing increased risk of falling out of education, employment or training, and then also becoming caught up in more serious violence. And early feedback on that project from my AP stakeholder group indicates that that funding has proved a real success. We know that while building on our world-class education system is vital, children will not be able to take advantage of it if they don't grow up in safe, secure environments. And early help is of a fundamental importance to promoting the welfare of vulnerable children, and now more important than ever. And this has been brought home to me by the sheer scale of work delivered by our See, Hear, Respond service, which was established in June to quickly identify and address the additional support needs of children, young people and families who've been affected by the pandemic or by national restrictions. And the partnership consists of 83 partners, local and national, who've helped find and protect 39,000 children who may otherwise have remained invisible without it. And I'm very pleased that we have been able to extend until the end of March those See, Hear, Respond services, which help children to reintegrate into school and to join in with youth work activities, and in addition, support for new or struggling parents. We've also funded additional capacity for the NSPCC's helpline to the end of the financial year so that adults can get advice and support on any concerns about the welfare of a child or young person. It would be remiss if I didn't mention the spending review, and I'd like to thank you all for your support during the process. And I'm sure you will agree it was right that the Chancellor focused on responding to the pandemic. I'm pleased that he announced an additional £1.5 billion of funding to local authorities with pressures arising from COVID, on top of the unprecedented support that has already been announced for councils during this incredibly challenging period. There's an additional £300 million for social care on top of the continuation of the existing £1.4 billion grant. And we know that the winter period will be challenging for families. So I'm delighted the government announced the £170 million fund through the COVID winter grant scheme, which means councils will be able to support families with food and other essentials. And in addition to that, we were able to announce that we'll be expanding our fantastic holiday activities and food programme all across the country from next year, in a programme worth £220 million that will operate over Easter, summer and Christmas. And then, of course, I welcome the fact that there's £165 million of funding announced in the spending review for the Troubled Families programme, and we'll be working really closely with MHCLG colleagues to ensure that this delivers for families facing those multiple interconnected problems that we need often break down into silos, and instead will help us to maximise cross-public sector coordination and collaboration. We do remain completely committed to a renewed focus on early help and to rebalancing the system so that children, young people and families can benefit from early intervention. So my message to all of you today is this government understands that early intervention can and does improve the lives of children, young people and their families. I want to work with you as champions of early intervention to break the cycles, promote the right support at the right time, and give our children the opportunity to achieve everything they're capable of. Thank you, Nick.
Thank you very much indeed, Minister. Ordinarily at this point I would lead the audience in a round of applause. Not really able to do that obviously now, but to thank you very much indeed for that contribution. And I know there will be spending announcements there that you made, as well as the announcement of a National Centre for the Family Hubs, which will be of real interest to our audience watching today, those who are taking part in the conference. So we have a little bit of time just for 2 or 3 questions from you all watching today. And the first of these I can see says, what plans does the government have for an integrated approach for children? This question that, you know, each government department ploughs its own furrow. Is there the possibility of having a pooled budget for true early intervention? I mean, you talked a bit about the work you're doing with Ministry of Communities and Housing and Local Government on troubled families. Are there other ambitions that you have for integrating policy and funding across departments? Well,
the first thing I'd like to say that a huge amount of my time this year has been working on cross-government pieces of work. Okay, and being the voice of children in many of the decisions that we've had to take during the pandemic, but also on other issues as well. So working with health ministers, working with the Home Office team of children who are at risk of being caught into serious violence or other harms, working with MHCLG on housing issues, especially for care leavers, as well as the other work that we do with them on local authorities. So there's been a huge amount of cross-government work continually, being the voice of children. The number of times I popped up on Zoom meetings during the first lockdown and throughout, just saying, from a child's perspective, so we're constantly bringing them together. But what we see in terms of the early intervention and that early support for families is, and why I love the Family Hub model so much, is that sometimes you talk to a family and they've gone to A and then B and then C and then D, and they're trying to get help in all these different places and they don't know where to go to for help. But when you bring in, and we all know this, when you bring the services together and they can signpost more easily to each other and work together, and the family doesn't need to retell their story again and again and again. The Westminster model I was so impressed by, where they agreed to share the family's data, if the family agrees to that, so the family doesn't need to retell their story again and again and again. But other partners can come together and work together to get that early help support in, which can be a range of different matters. My own Family Hub has been doing some excellent work with teenagers and mental health. It's not just about the preschool age groups. So that's why we said we wanted to champion this. It's not recreating children's services. It's not recreating all these services. It's saying, how do you as a local authority work together with all those different partners, be they health, be they police, be they others, to bring them together to signpost, be they voluntary sector support services there, to signpost them to the family better. And this idea of the hub is that it will be a sort of a dating agency you go to, what works in other different places, how do I learn about this, and how they can signpost that best place advice.
Great. Well, we have I think a specific question here which says, who will lead the National Centre for Family Hubs? I suppose we don't know that yet.
We don't know that, so we're going to be launching the procurement contract, and you can bid for it. One of the view of the Centre for Family Hubs is that once they get themselves up and running, they will also be able to help, you'll be able to commission them if you're a local authority to come help set up this service. But we are looking for bidders. It's, as I said, we're not recreating all of children's services. It's a small but significant amount of money that I hope will bring some real expertise in to help set this up.
Great. Fantastic. Okay. Well, thank you very much.
We'll announce the winner, I hope, in March and have it live by May.
Fantastic.
It's the aim.
Well, there we are. That's the answer to that. A procurement process, March and then May. I'm afraid we've now run out of time for this session, but it was great to have you with us, Minister. It's very good of you to come and to speak to us this afternoon. I'm sure everybody's taken a lot from that. We're very grateful
to be here. Thank you all for all you're doing. I know there's some amazing people working with children out there. You've worked so hard this year. I hope everybody gets a little bit of a break over Christmas, because I think we all need that. But you have just been amazing, everybody who's been working with children and young people this year. Thank you so much.
Thank you very much. Thank you very much.